Alright, here we're going to do a biomechanical assessment of this person's lower extremity. Frank, thanks for offering to help us out today. First thing we're going to do is we're going to check leg length. So I'm going to look at your medial malleolar and see if you're pretty good there. We're going to get you to reset. So I'm going to bring your ankles up. I'm going to get you to bridge up off the bed for me. Come back down. That's resetting the pelvis. And then we're going to come out and recheck. You're looking pretty good. We could also have you bend your knees, and we can look to see with your ankles next to each other, the knees together, if one tibia protrudes out more, or maybe the femur protrudes out more, to see if that leg length would be obvious there. Then we could look at our malleolar torsion next. So what I'm going to do here, Frank, is I'm just checking your ankles, and I'm seeing if you have any abnormal external rotation or shift of your tibia there. I'm going to look up pretty much along the length of your leg there. You're pretty much within a 20 to 30 degree range that they recommend. So that's pretty good, pretty normal. You check this bilaterally. Boom. Next, we can look at our midtarsal mobility, or first we look at forefoot position. You can relax. So we can see here that it's pretty even. 12 to 16 degrees is normal, so that is the case. And we can look at our midtarsal mobility. So we're going to check here, Frank, is how your second through fourth toes and segments are moving. So I'm going to get you into supination first, and then I'll move you dorsiflexion, abduction. Let's see, boom. I'm pretty rigid in supination. And then some eversion, not bad. Then we have you pronate a little bit, a little rigid there. So,
Dad just said no pain, no gain.
Thank you. And then we'll look at your first ray. So, alright, pretty good, a little more hypomobile in your first ray. Next we'll look at how it looks from the inside angle. So we can see we're a little plantar flex there. And then we can look and see how its mobility is measured. We could take, using a goniometer, we could measure the first ray and see what range of motion he has there. 60 degrees is what we're looking for, and he's got well past that. Then we'll look at some of his lesser digits to see if there's any significant dorsiflexion or plantar flexion. He's pretty good there. A little bit plantar flex at the beginning, but other than that, pretty good. Relax. Alrighty. Then we can look at see if any hallux is present. Hallux. He's pretty good there. That's Frank. That I'm looking at your pretty much your toe, how much it deviates inward or valgus, and you're pretty good. 0 to 15 degrees is pretty normal. And then more than 15 will be valgus. You're not there. Then we can look at your subtalar neutral. But before that, I'd mark his navicular bone right here. Boom and boom. I don't have that pen. Alright, now you can flip over. Boom. I can check your subtalar neutral by feeling for your talus bone, which is the bone between your ankle bones. And then I'd get to prominence there. I'd see how much your forefoot is varus or valgus. Seem pretty neutral. Maybe a slight bit of varus. Alrighty. Then we can look at your dorsiflexion. I could get a goniometer, line us up here, check dorsiflexion. And I could bring us up into plantar flexion or to knee bend, check dorsiflexion again. Measure the ankle. I can use the forefoot as my section of alignment. So boom, here we measure the forefoot. And then boom. Boom. And then we can also measure plantar flexion, so you bring your foot up toward the ceiling, or your toes toward the ceiling. Toes toward the ceiling. There you go. Then in line with the forefoot. Bam. Next, we could look at calcaneal inversion and eversion. So I could make some lines on the back of your leg here. And then I could get a goniometer on the back between his malleoli. The proximal arm can be in line with his lower leg, and the distal arm is going to be with the calcaneus. And then we could pretty much just check into eversion, and then check into inversion. Boop. You're looking for about 20 to 30 degrees in inversion and about 10 degrees of eversion. That's pretty close to normal, 2-to-1 ratio there. Then we can have you stand up. Alrighty, can you face the wall over there? Alrighty. So now we look at his neutral tibial stance. We could make some marks down his leg here, and then another one down to his foot. And then we put a inclinometer up on here to see how much neutrally his lower leg shaft is varus or valgus. More varus, as you can see here. And then we could also look at his neutral calcaneus position. So if we draw a line dividing his lower leg and then his ankle, he could we'd get him into subtalar neutral. We could do that by having him Frank, shift your weight to your right side. Now we could have him tell him to rotate your knee out to the left. There you go, right about there. And then we would measure where he's at right here with an inclinometer from about these 2 points. And then we'd ask him to relax. Frank, you can relax. And then we'd remeasure with an inclinometer here. About 4 to 6 degrees of excursion into whatever position he is in now is considered normal. So pretty much from a varus angle to more valgus, as you can see, he pronates. And from there, we can also look at his arch height. So Frank, if you could face the door.
This door?
The door over there. Yeah. Can you move this foot back a little bit? Actually, let's go over to this chair here. And sit down the chair. So we could measure his arch height by marking his navicular bone, which can palpate on the medial side of his foot. This is a little bone that we use to detect your arch height. The more you pronate, the more likely your arch is to collapse. So we'd mark that. We'd get him into subtalar neutral. Have him in optimal seated position with his knees over his feet. And then we'd hold your foot down. We'd do this for both feet. We'd have you stand up without moving. So stand up. And then we would have marked on a note card before he stood up where his navicular's height was, and then we could remark it at its new height. And we're looking for a 6 to 8 millimeter excursion as normal. Any less than that, he's got to have high arches, and any more than that, it's going to mean he's dropping to a lower arch. That means he'll have more functional arch drop. And then we look at his hallux dorsiflexion, which is his ability for his toe to come up off the ground when he's relaxed, when you're relaxed. More than we need. And then we could also look at his forefoot position. Turn around for me. And we look at his feet and see how many toes we can see from this angle. I can see about 3.5 on the left and kind of 3.5 on the right. So that's a little bit more than what we're looking for. And last but not least, actually, I think that pretty much sums it up.